Yeah, and then you can edit.
Yeah, I'll do that later.
Or I'll set pause.
My own video. Okay, folks, I'm going to hit start webinar, and Kevin, I will private chat you in about a minute.
All right. Well, good morning, everybody. Wherever you are in this world, I'm Kevin Hall. I'm the president at the University of Victoria in British Columbia, Canada. And I actually just wanted to point out today in Canada is a National Day of Reconciliation and Action for our Indigenous peoples. And I wanted to start off by acknowledging the land and language. I live on the lands of the Lekwungen people, the Songhees, the Esquimalt and Wasanich nations. And I wanted to pay my respects to elders past and present. And I think that's important that we do that wherever we are in this world. I have been globally involved in community-based research myself since the 1980s. I'm very committed to strengthening and building university and community partnerships. This particular session is focused on COVID-19 and some terrific projects that you're going to hear about. But I think is always critical, we think about university community relationships. And from my perspective, universities should be accessible to the communities. Universities should be present in the communities, and certainly at the University of Victoria, we have memorandums of understanding with all of our local communities. We do things together. We have joint innovation hubs. We have co-investment in anti-racism ambassadors, and we've actually created a United Nations training center in Victoria in partnership with all of our local communities. And I think that's a really important way of ensuring that we have deep two-way partnerships, meaningful partnerships. And a lot of our partnerships are mission-based. So we look at solving problems from a multidisciplinary perspective, which really brings a diversity of people, diversity of thought, diversity of background. The co-creation of knowledge with our partners, I think, is absolutely critical. So today in this session, you're going to hear from some terrific people who are going to tell us about innovation and civic engagement. We're going to hear about projects in Cameroon, Kenya, Mexico, Nicaragua, in Zimbabwe. We're going to talk a little bit about some of the shared challenges, how they align to the Sustainable Development Goals. We're going to talk about the role of innovation and creativity within universities and their communities. And of course, with universities, we're very old structures typically, and innovation is a hard thing sometimes to get moving, but you're going to hear from some fantastic examples of innovation within universities and communities. So our session today will start off with some self-introductions from our panelists. We're going to talk about the shared challenges. We're going to move on to 5 great examples of innovation and success in university community engagement. And then we'll end up with some what's next for this particular group and what's next actually for this field of study. And then there'll be a great opportunity for you to ask questions to our panelists. So with that, I'm going to turn it over to our panelists to go through the introductions.
Thank you, Kevin. Hello, everyone across the world. I'm Elvis Akomone from the Meridian Global University, Cameroon. We're working together in partnership with Access Care Foundation to provide access to basic healthcare services to persons trapped within an armed conflict in the Anglophone region of Cameroon, that is the northwest and southwest region of Cameroon. This armed conflict has led to the displacement of thousands out of their homes, either into neighboring cities or into bushes. And with this displacement, basic healthcare service supply was greatly disrupted. And with the coming of the pandemic, the bad situation only got worse. So we've been working together with Access Care Foundation to ensure that some of these displaced persons still get access to basic healthcare services. In the course of this session, we'll be highlighting some of the innovations that we've put together to resolve some of these challenges. Sharon?
Thank you, Elvis. I am Sharon Jones Melon. I work alongside Elvis at Meridian Global University as a coordinator for healthcare programs in partnership with Access Care Foundation. Before COVID, Access Care was involved in providing basic healthcare facilities to internally displaced persons within the northwest and the southwest region of Cameroon. But with the coming of COVID, as a medical doctor by profession, we're forced to champion our activities, not just to basic healthcare services, but also to educate and to educate communities on preventive measures of COVID and also in distribution of various COVID kits in order to curb some of the consequences of this pandemic. Thank you very much. Miguel, over to you.
Hola, buen día. Mi nombre es Miguel Ángel Escalón Aguilar. Colaboro en la Universidad Veracruzana en México, en uno de los países con mayor diversidad biológica y cultural, que se expresa de múltiples formas y que por fortuna aún se conservan muchos de estos recursos. La Universidad Veracruzana es una de las universidades más importantes, si no es que la más importante, en la región sur-sureste del país, y dentro de sus instalaciones se encuentra la Universidad Veracruzana Intercultural, que intenta dar voz, intenta aprender de las comunidades originarias sobre sus saberes y sus prácticas y conformar lo que llamamos comunidades de aprendizaje y de práctica para generar nuevos conocimientos. Nosotros colaboramos desde el 2003 en el impulso de procesos de articulación entre productores locales y consumidores, buscando desde la perspectiva de la agroecología, formar y fortalecer los procesos locales de alimentación sana. Con el COVID-19, muchas de estas iniciativas sociales se vieron detenidas, muchas personas, pequeñas y pequeños agricultores, vieron limitada su posibilidad de venta, y la oportunidad de trabajar en este proyecto, de contar con los apoyos para impulsar, volvimos a abrir los espacios de comercio local. Hoy las personas piensan en su alimentación como un elemento central. Estamos conectados en las diferentes regiones de la Universidad Veracruzana. Están al lado mío pequeños agricultores, pequeños productores. Estamos en las instalaciones de este mercado local que se llama Tianguis Agroecológico Jalapa, y les damos la bienvenida. Me gustaría terminar mi presentación invitándoles a que cierren los ojos, todas y todos, y que pensemos que la acción solidaria, la oportunidad que tenemos de vincularnos con pequeñas iniciativas locales, son la gran oportunidad para que desde una visión de alimentación sana podamos salir adelante todas y todos juntos y solidariamente. Muchas gracias.
Hi, everybody. My name is Cleana Amar. I'm Irish, you can hear from my accent, but I'm also Mexican. I work as Latin American officer at University College Cork in Ireland, but I'm also a very proud alumni of Universidad Veracruzana, with whom I've collaborated for over 25 years. So it's been amazing to work with Veracruzana. Both Cork and Veracruzana are engaged universities of the Talwar Network, and Veracruzana hosted the last Talwar Network Leaders Conference in Jalapa, the state capital in Veracruz. So it was great to have met a lot of you there, and great to meet others virtually here. So it's been inspiring and uplifting working with this group from Cameroon, Kenya, Zimbabwe, and Nicaragua. And of course, it's been amazing to work with the Veracruzana's projects in food security, agroecology, and creating a solidarity economy, which really is, hopefully has set building blocks for a better future and more local focused ways of supporting local green producers and more ethical consumers. So thanks. Over to Phil. So next slide. Sorry, Peter.
My name is Peter Kirira. I'm from Kenya, and I'm representing Mount Kenya University, as well as our partners, called Partners for Care. And with me in my room, I have a couple of members of staff who will carry out civic engagement activities with, and also very eager students who have remained in campus. Up to this time, it is past 7 p.m., but they are eager to learn about civic engagement activities that are happening across the world. So during this session, I'll be able to talk to you about our efforts and that of our partner to improve the health of economically disadvantaged community members through an innovative water delivery, storage, and dispensing device that came in particularly handy during the pandemic as a hard wash unit. I will also take you through our efforts to reduce giga infestations in economically disadvantaged communities of Kenya. And this has improved the overall annual rates of school attendance of our pupils who are missing school days due to opportunistic infections. I'm looking forward to a very interactive session. Over to you, Muriel.
Hola.
Hola, soy Muriel Suárez Sosa de Nicaragua, docente de la Universidad Nacional Autónoma de Nicaragua, la universidad más grande de Nicaragua, y es una universidad pública que tiene más de 40,000 estudiantes. Somos de una facultad de la zona norte de Nicaragua, ubicada en el municipio de Estelí. Soy trabajadora social y me desempeño en el área de extensión universitaria. Me acompañan en este salón estudiantes de trabajo social y de psicología que fueron parte de esta iniciativa.
Everybody, I'm with the students of I'm Liana, I'm from Nicaragua. We work, both of us work at UNAN. We are in this project in the north of the country. We have been working a lot to improve mental health, especially because it's attack our mind, and we need to be strong in order all of the damage has caused in our personal. So it has been a great experience to share all discover, and we have been working with all of this 500 family during this big fight against COVID-19.
presentation during the rest of the time we have. Thanks.
Thanks, Diana. My name is Phil Mulanda, and I am best known around in the academia space as the co-founder of Panari, which is an organization that our work within university students has been pretty phenomenal, and that's what I'll be sharing with you today. My background is in software engineering and consulting for both the private and public sector, and I mentioned that because it has an impact on some of the phenomenal students that we've worked with in Southern Africa, particularly the University of Zimbabwe. So firstly, I also want to take a moment to express our gratitude to all essential workers, frontline workers, and change makers who have been doing everything that they can to ensure everyone's safety. And this includes my colleagues on the panel who are running various projects over the last 1.5 years to respond to this crisis. This also includes relentless University of Zimbabwe students who have kept our staff at night during the onset of the pandemic with ideas of how to protect our economic livelihoods of community members. So today I want to tell you stories of their innovation in responding to this crisis, where we did great, we failed, and times we all leaned amongst each other in this community of practice, and most importantly, to ensure that we reward and enable students to dream and find support at higher learning institutions. Think about it. We're trying, during this global pandemic, I think we really should be rethinking our curricula and perhaps promoting stories and encouraging students to act now instead of waiting and hoping that they will transform societies after college, after 4 years. I really think the time is right now. We have to begin transforming our education system. As a former college student myself, I know the bureaucracy that exists at institutions. And that is partly why Panari was formed, to circumnavigate that red tape. And we also know the muscle and the impact that universities have. So we want to expose students to what they really need in order to grow. We've had a couple of shared challenges, and my colleagues will take us through that in the next slide. Thank you.
Thank you, Phil. I believe I'm correct to say that my colleague and I come from countries that had challenges of a universal provision of healthcare services before the pandemic. And when COVID happened, it hit our countries hard. It put more pressure on our health system, sort of a double whammy. So I'll talk about SDG number 3, which is a good health and well-being, as well as SDG number 6, which is on clean water and sanitation. For example, in Kenya, the lockdown interfered with our civic engagement efforts, particularly our Save Water program that is working towards ensuring that the marginalized communities consume safe water. I mean, the government of Kenya, and I know other governments in other countries, closed all learning institutions, and our students were sent home, especially our students who even support our community outreach activity. It, however, opened an opportunity for us to expand our programs, since we were able to provide much needed hard wash units to the marginalized society in the slum areas of Nairobi. And this was an important intervention, since washing hands has been documented to be a very effective way to reduce the spread of the virus. So to address the issue of mobility, we were able to, as a university, obtain special permits. And this allowed us to be able to reach communities that needed our interventions. And therefore, we are still able to continue providing the much needed efforts. In Cameroon, the challenge of provision of healthcare services needs to person trapped or displaced by the armed conflict in the Anglophone areas of Cameroon was also made grave since week-long lockdowns on the residents. Population by armed separatists had a major effect on persons with chronic illnesses who normally need regular medication. And that's where Meridian Global University, that will be making their presentation, came in together with the Access Care partners to lessen this burden. We have had other challenges other than physical health issues. The mental health issue brought about by the pandemic has been reported in all our countries. And this is largely due to the stress brought about by confinement and isolation, job losses, deaths due to the pandemic, separation due to travel restrictions, and many other factors. And therefore, the challenge of psychosocial health and wellness habits was a point of focus of our partners in Nicaragua, especially who are able to promote community awareness on the importance of mental health during the COVID-19 crisis. So I will allow my colleague to talk about SDGs number 4 and 17.
Thank you, Peter. One of the shared challenges we had during this project was problems with internet access. It was a major problem in order for us to attain a good educational system and enable a good civic engagement in the activities we're carrying out at that point in time. With the coming of COVID, before COVID-19, most studies in many parts of Africa, especially Cameroon as a whole, was on campus. But with the coming of COVID-19 and the great breakdown, students were forced to send home as schools were closed. As a result of that, most schools were forced to go into online studies. But there was a major setback, which was internet access. We had a great problem with internet access, which was hardly available. Not just available, even when it was available, there was problem with it being affordable. And even many students didn't even have the knowledge with most of the platforms, online platforms of studies. And those that didn't have the knowledge lacked the gadgets, like a good laptop, a good phone in order to access this online study. This became a major setback for studies and caused so many students to either drop out or were forced to be absent in most of the classes. I will hand over to my next colleague to continue with the next shared challenges which we had during this COVID period.
Thanks, Sharon. Yes, we shared many challenges, and also in the SDGs 8 and 11. It's related to common livelihood, food, and security and solidarity economy. We had to innovate in order to face these actions. For example, in Zimbabwe, they were working on different projects to improve entrepreneurship, because economy was a little bit hard, and many places they were in situations very hard because they had to get access to buy many products to protect themselves against this pandemic. And the economy was very difficult. Many places were closing. And also we need to improve our healthy food, because we were having issues on that. As Mexico was developing different campaigns with different indigenous groups to give them information about the pandemic and how they could, through healthy food, protect themselves and strengthen their immune system. We were facing many challenges, more than these ones, but we were working together in order to improve them, in order to face them with the experience of all of the different countries and all of their points they have. We were sharing as priorities, and we were working together through all of these challenges.
Indeed, Lena, the pandemic took everybody, the whole world at large by surprise. Nobody knew what was happening. Nobody knew what to do next. Nobody knew where to go next. A lot was mitigated. A lot has not been mitigated. A lot is being planned to be done. In Cameroon, we had a more challenging situation in that there was an armed conflict that had been going on for 5 years before the pandemic. Separatist fighters in the Anglophone region seeking autonomy, fighting the government forces, and this has always resulted in cases of shutdowns. Presently, we are in a lockdown, 3 weeks lockdown counting. We are unable to access our campus. We are unable to access any public service within these 3 weeks that will culminate with the celebration, of course, please, celebration of the independence of the self-proclaimed state of Ambazonia in southern Cameroon. With this, thousands have been displaced from their homes, seeking refuge either in neighboring cities or in bushes. Within these conditions and this context, healthcare provision was greatly disrupted. Women could not have access to antenatal services. Safe delivery was a challenge. Vaccination of their kids was a big problem. Young girls who were forced to live together in a very enclosed environment were exposed to sexual violence. Of course, in the midst of an armed conflict, there are always cases of sexual abuses and so on. And of course, the situation only got worse with the advent of the pandemic. COVID-19 brought an extraordinarily difficult situation to these Cameroonians, as their living conditions, which were already too bad, could not or simply perpetuated an atmosphere for easily spread of the pandemic. In the midst of this, Access Care Foundation and Meridian Global University came up with some innovations to mitigate the effects of this pandemic within this context. Primarily, we're providing malaria prophylactic services to pregnant women to ensure safe delivery and preventing miscarriages related to malaria infections. We also ensure that HIV patients were receiving drugs regularly and everybody was screened. Everybody was willing was screened. Malaria treatment was provided to all sick and identified persons, while the provision of long-lasting insecticidal nets were a routine supply to all households within our reaching communities. We help provide antenatal services to all pregnant women and follow them up during pregnancy to term, and also ensuring safe delivery within the context which we could afford. Family planning services was also provided to young women. Contraceptives were all made available to women, and they were educated on a different contraceptives, and they willfully consented to a line of contraceptive. Young children within an overcrowding condition are always exposed to poor sanitary conditions and hermetic infections. Therefore, deworming services, which were part of our program, was a great move to help cope the rampant effect of hermetic infections within these kids. COVID-19 was an extraordinary situation, as I've highlighted already, but a lot surrounded the pandemic. First, we had conspiracy theories as to the origin of the virus, the causative etiologic agents of the disease, and how the disease could be prevented and even cured. In the midst of this, we embarked also on education campaigns to try to straighten the etiologic agents of the virus, of the disease, and how the virus could be contained within these overcrowding settings. Therefore, we were able to install washing stations within these popular communities where access was very difficult. You can talk to somebody about proper hand washing, proper hand hygiene, which was a very, very central and pivotal component in prevention practices in the midst of COVID. But they'll tell you we don't have water. So in a bit to address this, we had to install within the popular junctions within the communities these washing stations, so that when you return from home sorry, when you return from work or when you are leaving home, you could stop by and have a hand wash so that some of the spread is already reduced. Also, hand sanitizers and face masks was also made available to some of these community dwellers so that they could always use them. There was a compulsory mandate on the use of face masks in Cameroon, but the problem was affordability. Imagine a woman who cannot earn $1 a day being forced to buy a face mask whose price skyrocketed within that period. So yes, compliance is okay, but how can I put on a face mask when I don't have one? So in a bit to address this, we had to provide a reusable face masks to these communities so that they could always go about their activities, because the bigger problem there was, if you are caught in public places without a face mask, you were arrested and either detained or forced to pay a fine. So most of them preferred staying home and losing economic time and getting livelihood also lost in the course of this. So it was a very, very welcome initiative to address or to mitigate the effect of this pandemic. Again, there's a lot that could be done, but we could only manage to do a little that we could afford. Peter?
Yes, I will talk about our innovative and success stories in Kenya. And we focused on improving the health of children and access to safe water. Like I mentioned before, together with our partners, who are called Partners for Care, the COVID situation brought about the need to set up hard wash units, especially in communities that live in that are economically disadvantaged. And we have been able to set up more than 2,500 hard wash units. And these units have contributed to our compliance to COVID-19 health guidelines, especially in the slum areas of Nairobi. And when COVID pandemic hit, you realize that some of these things, like my former, the previous speaker has said, some of these interventions became expensive because of the demand. And therefore, this effort to provide these much needed washing units was very useful and helpful. The other activity we have been able to do is that we continued our civic engagement efforts, which we have been doing again with our partners. And during the same pandemic season, we were able to treat 3,542 persons who are jiggers in 18 villages and 12 primary schools. And this was done in the coastal area of our country. This is a continuation of our joint efforts that have seen us manage to treat jiggers in 26 primary schools in Marsabit County in Kenya. And we want to continue to solve this preventable cause of problem, especially to children, some of who have dropped out of school because of challenges of mobility, others because of the issue of opportunistic infections. In addition, as you are doing this treatment, one of the things we make sure to do is that we build the capacity of the families by training them on local solutions that will enable them to eradicate the jiggers, because we believe use of locally available solutions is a more sustainable way of ensuring that we don't have recurrence of these infections. And by targeting all these families, we have been able to reach more than 2,500 residents who we have trained on how to use locally available materials to mitigate this challenge. In addition, we have distributed about 1,000 water backpacks. As you can see on that picture, these are a convenient way of transporting water, storing water, and also dispensing water. It is a better way of handling water as compared to use of jerry cans, which is very common in most African countries. And these jerry cans are normally not meant for use, for clean water use, because they are normally recycled from pharmaceutical companies. So by the use of this innovative way of transporting water, we believe that this will not only help our women who have to struggle with these jerry cans, but also to help spread the message of a use of clean and safe water. Because when you are distributing the water backpacks, we normally also ensure that we train our communities on how to treat this water, because our mantra is that if you put unsafe water in either a water backpack or even a jerry can, what will come out is water that is not safe. And therefore, we also train them on how to treat that water so they are able to take clean and safe water. And we have done this in primary schools because we believe our children are the agents of change. And also we want to ensure we protect this young generation by ensuring that they don't fall into issues of waterborne illnesses. And also in our early childhood development units. Thank you. Over to the next presenter.
Gracias. Bueno, ojalá y puedan ver en mi computadora. Voy a tratar de ver atrás de mí. Y si saludan, por favor, todas y todos. Hay muchos productos atrás, nada más por en la ubicación. Alcen su manita y saluden, por favor. Están pequeños productores locales que nos acompañan el día de hoy en esta celebración, de este evento, que nos parece fundamental porque entregamos los resultados de estos procesos en los que estuvimos acompañando. El estado de Veracruz, el lugar en donde vivimos y donde impulsamos y donde la Universidad Veracruzana se encuentra, es uno de los lugares con mayor biodiversidad, con mayor diversidad cultural, y que hoy, por desgracia, enfrenta problemas muy serios de salud y de alimentación. Cerca del 50% de la población vive en pobreza y 22% de la población vive en inseguridad alimentaria. Con el tema de la pandemia, nos llegó de sorpresa, de un día para otro. Tuvimos que dejar todo, tuvimos que cerrar los mercados, tuvimos que cerrar los lugares de abastecimiento de alimentos, solamente algunos estaban abiertos. La gente se tuvo que ir a su casa, había un temor mundial y muchas personas entonces perdieron la posibilidad de tener un ingreso económico. Si ustedes imaginan que el 50% de la población vive en pobreza y se tiene que ir a su casa por el tema de una enfermedad, pues muchas personas perdieron sus empleos que eran temporales. Muchas personas se vieron con la limitación de poder llevar alimentos a sus casas. Y entonces era necesario imaginar formas creativas para mantener la producción. Muchas personas, desde estos miedos que generó esta pequeña partícula viral, también reflexionaron sobre sus hábitos de alimentación. Muchas personas, aprovechando este tiempo de permanencia en casa, quisieron impulsar sus propios huertos, sus propios espacios de producción de alimentos. Muchas personas sabían que podían acceder a estos alimentos, pero no sabían cómo hacerlo, cómo vincularse para tener estas posibilidades. En un contexto como el que les comparto, el poder fortalecer estas alianzas de la producción local, iniciativas que desde hace muchos años se están impulsando en donde vivimos, con la necesidad de muchas personas de tener alimentos sanos, era muy importante. Entonces, este proyecto, cuando nosotros estábamos trabajando con las pequeñas iniciativas de agricultoras, de campesinos, de productores, siempre nos decían, es que en el campo no ha cambiado nada, porque seguimos saliendo a trabajar a nuestras parcelas, pero sí necesitamos el apoyo para que nuestra producción pueda ser comercializada de manera adecuada. Impulsar iniciativas de consumo local parecía que era la alternativa. Muchas comunidades se vieron marginadas porque el acceso a las tecnologías se veían, no llegaba simplemente la conexión de internet, y muchos estudiantes tuvieron que estar en su casa, a veces desde un celular, un teléfono celular, compartiéndolo para toda la familia, a veces teniendo que irse al lugar en donde podía haber un poco de señal para poder acceder a estas formas de educarse. Entonces, emergen iniciativas creativas que permiten un poco avanzar sobre estos procesos. Nosotros colaboramos en, primero, tratar de mantener estas iniciativas de producción y consumo local. Segundo, en impulsar procesos de formación para que las personas de la ciudad que tenían la intención de poner sus huertos pudieran avanzar en ello. Y tercero, en generar materiales didácticos, materiales que visibilizaran que estas formas y estas alianzas de producción y consumo local podían abrirnos un nuevo horizonte sobre la salud y sobre nuestra forma de estar en el planeta. Entonces, nos dimos a la tarea de buscar un espacio en donde pudiera estar, donde pudiéramos reabrir un mercado local que está desde 2003. Nos dimos a la tarea de hacer alianzas con el gobierno local, el ayuntamiento, con el gobierno estatal, para tratar de hacer visible que muchas personas podían hacer esto. El lugar en el que estamos hoy, y agradezco a todas las personas que han venido de la Universidad Veracruzana, estudiantes, académicos, investigadores, que hoy van a poder degustar los productos de nuestras compañeras y nuestros compañeros que están ahí en esta imagen, nos parece importante, porque hacemos visible estos procesos. Decimos nosotros que le podemos dar rostro a la comida. ¿Qué trabajamos? Y aprovechando las tecnologías de la información y la comunicación, trabajamos en el desarrollo de una plataforma que se llama Tlaxinepali, y esta plataforma electrónica lo que va a hacer es que los productores locales van a poder ofertar sus alimentos y la comunidad universitaria y la comunidad de la ciudad va a poder acceder a estos alimentos a través de internet. Esta posibilidad de poder ofrecer los productos que en el campo se siguen produciendo nos parece que es importante. Porque no importa dónde estés, eres visible, porque no importa dónde estés, podemos acceder a tus alimentos y podemos hacer llegar a la población estos alimentos de calidad. También, en colaboración, para que las personas pudieran producir alimentos en su casa, se creó la iniciativa de grupos de apoyo para la producción de alimentos en casa. Les llamamos grupos APAC. A lo largo de los años hemos ido fortaleciendo la formación de promotores, de personas que saben cultivar sus alimentos, y las invitamos a que fueran facilitadores de lo que llamamos los grupos APAC. Grupos entre 5 y 9 personas se organizaron, había una facilitadora, un facilitador, y creamos comunidades de práctica. Así, aprovechando las tecnologías, mucha gente preguntaba, mucha gente se organizaba, y estos pequeños grupos, estas pequeñas células de aprendizaje, iban generando nuevos saberes. Se compartían semillas, se compartían saberes, se compartían prácticas, y de repente entonces empezamos a tener muchos lugares, muchas casas que estaban produciendo sus propios alimentos. Uno de los elementos que observábamos que podían estar haciendo falta era la información. Muchas veces las personas acceden a Internet para ver la información de cómo cultivar sus alimentos, pero a veces entre lo que yo encuentro en la realidad y lo que tengo en la bibliografía, en la información que encuentro en Internet no es real. Entonces, con un grupo de estudiantes liderado por Daniela Aldazaba, que también ganó un premio de esta red, nos dimos a la tarea de crear materiales didácticos. Materiales didácticos a partir de los saberes locales que existen en nuestra comunidad. Entonces nos pusimos a organizar talleres, nos pusimos a organizar webinarios, nos pusimos a organizar encuentros virtuales y en algún momento presenciales, para que todos estos saberes sobre la producción de alimentos se pudieran formalizar en una serie de infografías en donde pudimos traducirlas a lenguas originarias para que en las comunidades indígenas también pudiera llegar esta información y estos saberes. También quisimos darle rostro a las personas, a estas personas que ustedes ven en esos pequeños hexágonos que están ahí y que están hoy por fortuna atrás nuestro. Y entonces hicimos una alianza con el municipio, con las autoridades municipales, con las autoridades del estado para reactivar la economía local. Organizamos un evento en el marco del Día Mundial de lo Local, en donde más de 212 productores en diferentes partes de la ciudad pudieron ofrecer sus productos a toda la ciudadanía con las medidas de la sana distancia, como un mecanismo para reactivar esta economía local, que para nosotros es fundamental porque si no, no podíamos tener ingreso, no podían tener ingreso estas personas. Hicimos también, y esto está disponible en nuestra página, una serie de videos técnicos que la gente pueda acceder para tener más información. Hicimos la traducción en lenguas originarias, hoy lo estamos traduciendo a otros idiomas, y también hicimos unos pequeños documentales sobre las historias de las hombres, mujeres que acompañan este proceso. Esto entonces ha sido el resultado de una alianza fundamental al interior de la Universidad Veracruzana, entre la Dirección de Relaciones Internacionales, entre la Universidad Veracruzana Intercultural, entre la Dirección General de Vinculación y la Coordinación de Sustentabilidad de la Universidad Veracruzana, para que estos esfuerzos al interior de nuestra universidad se puedan formalizar. Pero también ha sido una alianza muy grande con los actores que están fuera de la universidad y que nos lleva a imaginar que sí podemos construir otros mundos posibles. Hicimos alianzas con las autoridades municipales, con las autoridades del Estado, con las organizaciones de la sociedad civil, con los medios de comunicación para esto. Y solamente en 30 segundos quiero presentarles, y voy a pedir que se acerque aquí, Demetrio, un pequeño productor, para que nos comparta unas palabras sobre esto. Demetrio, por favor, 30 segundos. Muy rápido.
Antes que nada, me da muchísimo gusto el agradecer principalmente por la vida. Hoy estar vivo para mí es un gusto enorme, pero también otro gusto enorme compartir este espacio donde pueda ofertar lo que con gusto se produce en ese campo, en ese suelo que por fortuna nos ha tocado vivir. Quiero agradecer el espacio donde podemos ofertar aquí nuestros productos que cada uno de mis compañeros trae. Yo creo que en esta situación de pandemia a nivel mundial, la base de nuestro bienestar y nuestra salud es la alimentación. Una alimentación libre de agroquímicos, de pesticidas y de fungicidas. Creo, y lo puedo decir con certeza, tengo a mi familia, tengo dos pequeñas, una en primaria y otra en secundaria. Cuando ellas me dicen que quieren acompañarme a la finca, veo cómo disfrutan, le atrae mucho las flores a la más pequeña y a la mayor las semillas. Disfrutan enormemente el cortar la fruta con su propia mano. Por lo tanto, yo creo, y así lo puedo decir, que nuestra salud en esta situación de pandemia es nuestra alimentación, la que nos va a fortalecer, la que nos va a dar vida, la que nos va a dar esa salud.
Muchas gracias.
Buenas, nuevamente compartiré la experiencia que desarrollamos en Nicaragua. La pandemia surgió en marzo del 2020 y el dilema era qué hacer, ¿verdad? Creo que el mundo entero se llenó de miedo, sobre todo por la incertidumbre, la falta de información, y participamos con esta propuesta pensando en fortalecer la comunidad universitaria y su entorno, y sobre todo la parte biopsicosocial. Y comenzamos a identificar que en medio de todo el miedo hay grupos más vulnerables que otros. Hay grupos que tienen más información, hay grupos que no tienen información, que no tienen acceso a Internet. Entonces fue una de las primeras decisiones y análisis, ver eso de la vulnerabilidad, porque el COVID-19 deja al descubierto otras problemáticas como las desigualdades sociales. Entonces comenzamos a trabajar la educación emocional. ¿A partir de qué se nos ocurre? La misma campaña de miedo, fuimos víctimas de falsas noticias a nivel nacional e internacional, falsas noticias que nos limitaban, que nos obstaculizaban a avanzar como ser humano, que no sabíamos si el fin del mundo lo teníamos tan cerca. Y entonces comenzamos a pensar que era necesario contrarrestar todo esto trabajando la educación emocional y fortalecer los mecanismos de defensa del ser humano como competencias necesarias para enfrentar la vida a nivel personal, familiar y comunitario. En todo esto vimos y visibilizamos, no nos miramos solos como universidad, nos vimos siempre como alianza con el entorno. Nos aliamos en alianza con el Ministerio de Salud, en alianza con el Ministerio de Educación, y comenzamos a ver nuestros procesos de acción desde un modelo sistémico. No podemos trabajar, nuestros estudiantes a la universidad venían atemorizados, ellos eran parte de una familia, sus familias estaban atemorizadas, sus hermanitos estaban atemorizados, la comunidad entera atemorizada. Entonces pensamos que era necesario trabajar desde el modelo sistémico. Teníamos que fortalecer la comunidad, los barrios de donde son originarios nuestros estudiantes, pero además las comunidades aledañas, las escuelas. Y comenzaron a surgir un montón de iniciativas innovadoras a nivel psicosocial. Comenzamos a trabajar, comenzamos que necesitábamos seguir viviendo, porque el miedo no nos alimentaba, el miedo nos deterioraba como seres humanos y nos estaba limitando a avanzar, producir, porque tenemos que sobrevivir. No existe una posibilidad en el mundo de que un país se siente a brazos cruzados y va a vivir. No es así. Nosotros somos un país que vive de la microempresa, y entonces comenzamos a desarrollar otras iniciativas. A nivel emocional, trabajamos la mochila emocional, comenzamos a pensar qué necesitaba el ser humano en momentos de miedo. Necesitaba solidaridad, necesitaba respeto, pero necesitaba información real. No necesitaba ser atemorizado con una falsa noticia, con un falso entierro, con esto, con lo otro, o con una información equivocada sobre la solución de la pandemia, que el mundo entero vivió situaciones de acaparamiento de recursos. Todo el mundo quería comprar el jabón, todo el mundo quería comprar el papel higiénico. Entonces comenzamos a contrarrestarnos y a fortalecernos como ser humano y trabajamos varias propuestas, primeramente de manera virtual. Una de ellas fue la mochila emocional, que era unas publicaciones en el 2020, eran publicaciones cada 2 días, y esas publicaciones no tenían un orden, sino que respondían al contexto, cómo nos sentíamos los nicaragüenses en ese momento, y comenzamos a hacer una mochila que nos aliviaba, que nos motivara a continuar. Y además de eso comenzamos y vimos la necesidad de la parte económica, y comenzamos a trabajar tips económicos, qué teníamos que hacer, si era conveniente como familias que gastaran todos los recursos en jabón líquido o en alcohol gel, o sea, qué necesitaba, cómo tenía que organizar los recursos, porque como lo han mencionado todos los otros compañeros de otros países, la situación de empleo comenzó a deteriorarse. Entonces comenzamos a trabajar los tips económicos, pero también comenzamos a trabajar otra estrategia del yo emprendedor. ¿Qué tenía que hacer la persona que tenía su trabajo, su venta? Nosotros en Nicaragua usamos el término de pulpería, su venta para poder continuar, para atender a sus vecinos, para poder vender sus productos que elaboraba y poder alimentar a su familia. Entonces, además de eso, comenzamos a trabajar como otra campaña que era Unidos y Solidarios, cómo respetar a las personas que tenían COVID, porque es el mundo entero nos movemos en esto de cómo apoyarnos y motivarnos a continuar cuando estamos claros que la pandemia nos afecta la parte emocional. Entonces comenzamos todas esas estrategias de manera virtual, pero también vinculadas con la comunidad, haciendo visitas coordinadas con las alianzas que tenemos establecidas con el MINSA, el Ministerio de Salud, el Ministerio de Educación, haciendo talleres en la escuela con las niñas y los niños, y motivando, reflexionando sobre eso, cómo protegernos, cómo continuar, pero viviendo la pandemia, pero demostrándonos amor, compromiso, solidaridad y sobre todo con una conciencia de que todos somos seres humanos y que tenemos que avanzar. Y la estrategia fue esa, y a nivel de universidad comenzamos a trabajar la educación emocional, la salud física, mejorando estilos de vida para poder enfrentar pues la pandemia que la tenemos todavía con nosotros, ¿verdad? Y estamos mejorando mecanismos. Bueno, muchas gracias.
Thank you. So just kind of as a quick recap and to set the stage with regards to how Panari worked with University of Zimbabwe students and community members. It might be important for me to kind of define what Panari means. And it's a Shona word, which means at the peak or the apex. And it comes from our belief that people are innately innovative, and given the right resources, we will reach the personal, they'll all reach the personal peak. So my friends talked a little bit about, our shared national challenges. There's so many overlaps with some of the challenges that we have in Zimbabwe and Nicaragua and Mexico. And obviously the pandemic did not make it easy for us as well, particularly for an already struggling economy. So to stop the spread of the COVID-19 pandemic, just like many other countries, there was a national strategy to have a lockdown, which is kind of staggered across different levels based on the statistics. And of course, at that time, we had a lot of students calling us and recent graduates as well. They're just calling us with ideas of how we could help. And the problem was we couldn't really travel. And even reading a lot of reports that were coming out of the World Health Organization and McKinsey reports as well, analysis like what's going to happen in the future, it was pretty evident that we didn't know what we didn't know. And at any time we're trying to address a problem, you want to know, you want to have some data, you want to know, you want to have some, you know, pretty solid predictions of how things are going to turn out, but we didn't have that. I mean, this was a common struggle across the globe. So we all agreed, as we were brainstorming with the students, like we all agreed that the solution lay somewhere in first collecting data to inform our needs assessment. So together with the students, we built some kind of an open source crowd mapping digital platform, which captured and really helped us to visualize the impacts of COVID-19 on a map. So as you can see kind of on this visual, this is a screenshot of the website. So let me try to unpack it actually a little bit. And as you can see from that slide, this is a website that allowed students who in this case, you know, we're working together with the students as the creators of this tool. And we're capturing data from community members, healthcare providers, the public, everybody. And so it's important when you're trying to do that. Now, you're trying to do that at a time when people are locked in their houses. They can't walk, they can't move. So you've got to be innovative on how can you collect this information. And also, you also want to make sure that you're collecting raw information, not information that's been filtered by any agency or anything. So we really are trying to get the voice from people from their homes, like, hey, what's going on? Like, let's first get as much data as we can. We're not even trying to filter it out as it gets in. And so we're getting it from Twitter, from email, directly via the web. We're getting it from people's phones, and it doesn't matter what type of phone you have. You've got a smartphone, great, you can use the app. You got a feature phone, that phone that doesn't, you know, that doesn't have those smart capabilities, you could still use that. And also that's like some innovation that's going on into that went into this platform to make sure that, okay, let's have someone who doesn't even have access to internet access. Zimbabwe right now, I think it's in the top, if it's not the country that has the highest internet data rates costs, it's definitely in the top 5 amongst, and some of the countries that are in that top 5 category are like war zone countries. So we were trying to be cognizant of that as well, that, okay, the job market is shrunk. There's not a lot of income. So let's also maybe have people text and for free. And then that text function, we have a little gateway server that transforms all text coming in into data that can be consumed by the website. So we start getting a lot of input, and this reads something like, I guess examples of information that we're getting is folks telling us like, look, we know that we need to wash our hands for however long that was, 15 seconds. But the problem is for the last 2 weeks, we haven't had water. So that's not helping. And, or like, you know, someone is saying, hey, just so you know, with regards to COVID, I built this hand sanitizing tool with very cheap materials, and this is how I put it together. Someone is asking like, hey, do you know where I can get fuel? Do you know where I can get a certain service without going against the country's mandates, the curfews and stuff? And someone is saying, hey, my business has been closed. I am dead either way, so I'm just gonna risk it. I'm gonna, you know, so we're getting so much information. And so the exercise that we went through was with the University of Zimbabwe students, we decided, okay, let's categorize all this data. That we have a very large data set. We generated reports and, you know, kind of came up with some trends on the social and economic impacts of COVID-19. And the good thing also was all the information that we're getting, it's included on it is all the information, most of it, not all of it, but most of it is geotagged. So we have a way, as you can see too in that graphic, whatever information is coming through, it is being overlaid on a map. So we know where this information is coming from. Now, based on these reports, we began engaging public health experts, developed any material that we thought was necessary based on what different communities needed. So COVID-19 sensitization material, awareness, mitigation, workshop materials, tailored brochures, fact sheets, and posters, if that's what was needed in the community. So from these data sets, the students had their attention drawn to a community that is in the outskirts of the city, in a place called Mapuku. And they decided to focus on, because the need there was, there's so many youth that are in that community that are working, that have small to medium enterprises. So their operations were halted from this crisis. So then the business owners were at risk to losing their markets, and they had provided some of their information on this platform. And then the students decided, okay, well, let's focus. We do have the resources to kind of help with this. These are students from, multidisciplinary fields. You've got accounting students, you've got sociology, medical students, and everybody. So, and then we also engaged some specialists who have worked on some programs with the International Labor Organization. And together with the students, we began training these business owners on how to build some resilience and cope with these economic shocks. The ultimate goal was, prompting early economic recovery and sustainability, and then building some sort of sustainability of these businesses. One of the things that we also did is we started engaging with the business owners that were identified, was coming up with a revolving loan facility. And because the students had also realized that the recovery for small businesses in the informal sector would be a real problem. And one of the main challenges was working capital and liquidity shortages. So we kind of needed to help them kind of kickstart their businesses like that, since they've been kind of affected. So these student-led workshops with community members, I think for the most part, they restored hope, and they equipped business owners with practical methods to adapt their businesses to this current situation. And being in these communities, community members knowing that this is a group of students from the University of Zimbabwe, obviously strengthened that community relationship with the university. And this is one of many examples that we have engaged with universities. And I think my ask is, I'm not asking us to change our operations overnight. But I also think, drawing from my background too as a software engineer, I'm confident that we can employ some design thinking methodologies to address big, complex problems little by little. Like we know there's a lot of work to be done with regards to how our curriculums are set up, how we reward our students, how we can make focusing on community, on civic engagement initiatives be more relevant and be more commonplace with universities. To do something like that, you should not have to go through a lot of hoops to be able to. So I think solutions from the last decade not all of them can still be applied to the challenges that we're facing during this pandemic and hopefully during post-pandemic. We live in a new world, folks, and we've got AI and data. that's going to change our landscape really quick. And it's not only going to be things that only computer science students have to worry about. It's going to change a lot of facets of how we relate and like how marginalized communities adapt. Remember the dot-com boom of the late 90s. AI and big data looks like 99 on steroids, and we have to harness it for good and to address inequality. This is an example of students using data to address inequality and to respond to crisis. The biggest skill that they have still is empathy. It's not building platforms. That's not going to be the hard problem. That's not going to be the challenge. And I think technology too has to be a cross-cutting theme across all of our university civic engagement efforts. And I think with more resources, we can scale more homegrown solutions like these, and we can begin to, just as now, we have hundreds, thousands of people tuned into this conference, and we've already demonstrated how much power we have, even across borders, through technology. So I think that these homegrown solutions, we have to scale them. We have to collaborate with other programs, just as this panel is doing, exchanging ideas across borders. I don't even, from how we've been working together, it does not feel like we've been, we're that far apart geographically. And I hope that we can have more programs as institutions create more scalable prototypes. Thank you.
Thank you, Phil. I think the next thing we have in our minds, what next? We've been able to put together these innovative ideas which have helped us address some of the challenges that are peculiar to our countries. I said peculiar, but as we could realize in the course of the presentation, the fact that Cameroonians were lacking basic healthcare services did not mean that they were going to school during the pandemic, did not mean that internet was affordable, did not also mean that livelihoods were not lost. So in the course of our time together, we have been able to understand the different approaches that were employed by our respective fellows to address the peculiar challenges. However, our goal here is that Cameroon could, for instance, pick the solution employed in Mexico to address the issue of livelihood, the solution employed in Zimbabwe to address the issue of internet access, and so on. So joining forces together is the common ground on which we want to live this day to day. We are looking towards opening and building up more coalitions, seeking more funding partners in order to address most of the challenges that we can easily identify. We want to express our sincere gratitude so far to the TNLC Network and the Open Society University Foundation for the funding we've received, and which enable us really push and for instance in Cameroon, help people go out of their homes to fetch for a living. Also help pregnant women deliver safely, and also help young girls prevent unwanted pregnancy and possibly criminal abortion. So as in the course of this session, still will be open to discuss more of our ideas and look forward to getting new partners, building new coalitions in order to foster the projects, expand our endeavors, and reach a larger majority. Cleona?
Thanks, yeah. And also as a group, we are exploring developing toolkits that others could apply and use in areas of interest. Miguel mentioned that there's material on Veracruzana's website related to growing your own vegetable garden, food security and nutrition, water access, entrepreneurship, and psychological health. Have put together a toolkit, which is now translated into English, and everybody's welcome to download. You'll get their website at the end. And finally, really with this experience, this inspiring team from different parts of the world, we really are convinced that we want to expand and grow the community of practice and share best practices with other Talwar Network members and their partners. And also we'd like to thank the Talwar Network and the Open Society University Network. And we really believe that growing community of practice globally is really necessary for us as higher education institutions to further embed community engagement into what we do and working towards Agenda 2030 and the Sustainable Development Goals. So on our final slide, we'd just like to thank everybody. And you can see on the QR codes, you'll get a link to our university websites. And also I'd like to thank my colleagues in Veracruzana. We are one of the remote hubs of the Leaders Conference. And we have colleagues in the 5 different regions who have gathered with their community partners, academics, students, and authorities. Also in 2 and 3 of the intercultural universities in the indigenous areas of Veracruz, and in one of our community ube houses. Apart from, and in all of these, there's a small little local producers market at the event. So thanks to all of them for putting that together and joining us. So over to you, Kevin, for questions and answers.
Fantastic.
And we're delighted. Mm-hmm.
Yeah, fantastic. Thanks, thanks, Cleona. And I hope everybody took a screenshot of that last slide so you can go to all the universities that have contributed to this session. And I wanted to thank, first of all, Elvis and Sharon from Cameroon, and Miguel and Cleona from Mexico, Peter from Kenya, Mirel and Liana from Nicaragua, and Phil from Zimbabwe. And I think, you know, what you've given us today was a snapshot into some incredible challenges that you're all facing. But you know, what strikes me is the commitment that you've all shown, the innovation and creativity, and the piece of being a real partner that's been really important to generating real impact. And I think everybody listening today has really been entranced in your stories that you presented. So thanks for all that. For people that have questions, if you can post them in the Q&A, we've got about 10 minutes or so for questions. I thought I would just start off with a relatively simple question for you all, and maybe we'll go country by country. But, you know, universities are very old-fashioned entities sometimes, and they don't always value community-based work. Sometimes they want you to write these publications in Nature and things like that. I'd be interested in what are some of the challenges you face for making this approach to research at your universities, and in fact, to look beyond. What are some of the barriers beyond the university to conducting this type of research? And perhaps we'll start with Elvis and Sharon in Cameroon, if you've got any thoughts around barriers that you face, either at your institution or in the communities doing this work.
Thanks, Kevin, for that question. I think operating in an armed conflict within the pandemic are some of the worst humanitarian emergencies that you could want or never wish to find yourself inside. I indicated in the course of my presentation that presently we've been under a lockdown, a separatist imposed lockdown for 3 weeks running. Within this lockdown, nobody is allowed to move out of the house, even for essential services. So as a healthcare service that we're basically doing home-to-home supply of or delivery of health basic services, it was a big challenge because some of these separatists, first of all, they are not very educated, so they don't identify whether you're an emergency worker or not. We've had situations where our nurses are harassed on the field, but thank God we've not had a bad situation where somebody was shot, but we've heard of those reports elsewhere. So when there's this lockdown, we are always limited to stay only within the confines of our facility, and we can't risk people's life. Imagine a pregnant woman getting to labor during these 3 weeks. The only thing we can do is to get somebody to the home of that woman to help in the process. So it's a big challenge, but as I indicated, we are very appreciative that we've not had the worst case of, effect.
All right, thanks, Elvis. Sharon, anything to add?
Just to add to what Elvis said, it's really been a difficult situation when it comes to health, but with the advent of COVID-19 was really more serious, because in a community where we are, the people have lost confidence in the government, and there are certain information that when it is sent out, they will hardly get to believe. Like the advent of COVID-19, it took a lot. It took months for Cameroonians to come to terms with the fact that there is something like COVID-19 and it's even found in their own country. So going out to sensitize the community, the people in the community about COVID-19, and even giving out the kits in order for them to prevent was really a difficult barrier to cross. We had a lot of sensitization to do and a lot of convincing to do in order to attain our goals. That's just what I wanted to add to what Elvis had to say. Thank you.
Great, thanks, Sharon. Peter, how about you in Kenya? What are the barriers that you've had to overcome in getting this community-based research off and going?
Yes, thank you, Kevin. I will say some of the barriers, actually. The fact that, and I think you alluded to it, the fact that usually you find when implementing some of these community outreach activities, the issues of resources are normally a barrier, even before COVID. And what you have done is to identify partners who we share values with. And we ensure that we work with these partners. We ensure that we fulfill our fiduciary duties to our donors so that they're able to see value for money. As an academic institution, we do impact assessment of our interventions to ensure that all resources make a difference to the communities that we intervene in. And the other thing we do is that we have a student population of about 40,000 students. And from there, we're able to tap a pool of many students who are able to go around the country and support our community engagement activities. So this ensures that even within a not so big budget, we're able to be impactful. Thank you.
Yeah, thanks, Peter. Miguel, Cleona, how about you in Veracruzana? What were the major barriers that you had to overcome or still have to overcome?
Gracias, Kevin. Me parece importante la pregunta. Muchas barreras. Una barrera, la tecnológica. A veces no toda la población tiene acceso a Internet. Los estudiantes de la Universidad Veracruzana Intercultural se han visto muy limitados por acceso a la tecnología y han inventado formas muy creativas de la educación. La otra es un cambio en la mentalidad de las personas. Mientras estuvimos en casa, mientras estuvimos confinados, pensábamos que había que cambiar nuestra forma de vida y nuestra forma de alimentación. Cuando pudimos regresar a la calle, mantuvimos nuestros niveles de consumo, mantuvimos nuestro anhelo del derroche, y hoy hacer un alto creo que vale la pena hacer, vale la pena. Hoy en nuestra universidad ya hay cambio de rector, y dos de los ejes fundamentales sobre los cuales el rector basa su nuevo plan de trabajo es la sustentabilidad y los derechos humanos. Pensamos que desde esta perspectiva de una visión a alcanzar toda la comunidad universitaria, las personas y las instituciones con las que nos vinculamos, desde estos dos elementos, la sustentabilidad y los derechos humanos, pueden ayudar mucho a vencer estas barreras, en donde el cambio de mentalidad es fundamental para hacer estos cambios sustantivos que hoy el mundo nos requiere para poder estar sin cubrebocas y con una buena alimentación. Gracias.
Thanks, Miguel and Cleona.
Yeah, just, I mean, the internet access, obviously, we all shared. And I mean, definitely there's something to be said for access to internet becoming, a basic human right for everybody. We learned it in the pandemic. And I suppose what Miguel mentioned it, but just to drill home, I mean, this is an opportunity to now build back better and, to embrace these new innovative practices. And I suppose the challenge is now to really learn from the pandemic and, and think about what we're eating, what we're consuming, locally and globally.
Right,
So, yeah.
Thanks, Cleona. Mirel and Liana, how about Nicaragua? What are your major barriers? We've just got a few minutes left, so if you can be relatively brief.
Bueno, creo que vencer las representaciones sociales, el miedo, que igual que el VIH-Sida en los 90, el COVID-19 vino a descubrir un montón de temores, inseguridades para relacionarnos. Y creo que también otra de las barreras es el acceso al Internet. Precisamente por eso nosotros no podemos tener clases en línea, porque únicamente el acceso a Internet y el acceso a medios tecnológicos para que los estudiantes puedan recibir sus clases es una de las grandes barreras.
Yes, we
Thanks.
also
And
had
Liana?
the issues with the lack of truthful information because we had a lot of fake news about the pandemic. So people was more afraid of the pandemic and didn't know how to act. So they were afraid, they were just trying to lock out themselves. And they were not going outside, not going to the university, especially our students, but as we don't have internet access as easy as on other countries. It was like they were not coming to the university, but they were not having access to their studies because they didn't have internet access. This was because of the fake news. So that was one of the biggest challenges we have to work on. And that's why we developed the emotional backpacks, giving them trustful information and some other tips how to manage their emotions.
Okay, thanks, Liana. And Phil, in Zimbabwe, it sounds like you sort of really used technology to try to drive some change. What are the big barriers ahead, do you see?
Yeah, I would say the same, pretty much the same that have already been listed, internet and resources and partnerships.
Yeah, okay, thanks. Unfortunately, we don't have time for any more questions, but I think it's really been important to listen to all of our presenters today. I think you've all presented some absolutely inspirational stories, some stories that just really resonate with all of us online here about the importance of universities and community coming together to really help solve some of these challenges during the pandemic. And I truly believe that once we're through this pandemic and we're into whatever an endemic, it's these partnerships that you've developed that will continue to solve some of these big global challenges and missions. And so thanks everybody again for participating on this panel today. It's been absolutely a fantastic panel. And I understand everybody's got somewhere to go very soon, like almost now. So I think you've got to close this session and then click onto your next link. Your next meeting is starting in about 27 seconds. So thanks everybody, and we'll see you all again.